Welcome back. We're going to open up this part of the conversation on our COVID-19 town hall with Hartford HealthCare's president and CEO, Jeffrey Flaks.
Mr. Flaks, running a healthcare system during a pandemic is a monumental task. We've seen it. You seem to be surviving round one. If there is round two, God forbid, will hospitals be in a better position to fight a possible second wave of this?
Well, we're doing everything possible. We're doing everything possible. There's been enormous lessons learned. We're building significant stockpiles of personal protective equipment. We're training. We're just putting all types of precautions in place. I think all health hospitals are working across the state with tremendous alignment and coordination, and we're working hand in hand with the state. So I am absolutely hopeful that should that second wave come, we'll even be more prepared than we were for the first.
Mr. Flaks, also we want to ask you about one of the most promising treatments we have for COVID-19 has been this drug, Remdesivir. We have some in Connecticut. We do not have enough. What is Hartford HealthCare doing to try to help get more, and how difficult is it to get that drug right now in the state of Connecticut?
So it's being coordinated through the federal government with the state government. All the hospitals are working together to prioritize needs. So it's been very encouraging, and it's just another example with working in partnership with the state government to do everything we can to advocate, position our state as strongly as we can, and to bring access to whatever the very best practices are here.
Boy, we all saw it. We all watched the early models together and watched you folks put up contingencies for more beds. How can you characterize this? Are we doing better than you first imagined when we entered this dark time some weeks and months ago?
Well, I'm incredibly proud. I'm so proud of, first of all, all the frontline workers today working in healthcare. They're doing an absolutely extraordinary job. The bravery, the courage, the expertise, the compassion. So I'm extraordinarily pleased, and I think we're having such great success. Really, more than 80% of the people who are entering our hospitals with COVID-19 are successfully being returned home. So we're enormously proud of that effort, and at the same time, we recognize this is a terrible virus, and there is mortality with it, and our hearts break to be encountering that level of mortality within our hospitals today.
Thank you, Mr. Flaks.